Now, medical experts are to investigate academic papers which suggest statins may be harmful. Millions of people take the drug to lower their cholesterol, and two report authors have now withdrawn their statements from the articles that they wrote after some of the figures they cited were found to be incorrect. Writing in today's BMJ, Editor-in-Chief Dr. Fiona Godley explained why she wanted to make sure people know about the statement retraction. She said it was so that patients who could benefit from statins are not wrongly deterred from starting or continuing treatment because of exaggerated concerns over side effects. Well, let's clear some of this up now with me, GP Dr. Rob Hicks. Rob, thanks very much for coming in. So, this article was written claiming that some statins could be harmful to some people, but that might not now be true.
That's the reality. And once again, statins are in the news and are raising debate. I think the reality in general practice, certainly in medicine around the world, we believe that statins have a benefit for patients. That's why they're prescribed in helping to reduce an individual's risk of having a heart attack and indeed of having a stroke. And I think it's important not to forget that in the UK, over 150,000 people have a stroke every year, and over 80,000 people have a heart attack every year, and the impact on them and their families is enormous.
So did you find, I mean, you obviously discussed it with your colleagues when this report came out, suggesting that there might be some problems with them. Did you stop prescribing? What did you do?
No, I think we looked at it and we had discussions, and obviously we thought, well, we deal with patients on an individual basis.
Yeah.
This isn't about, right, everybody should stop taking the medicine. The question was what is the degree of side effects? And we know that all medicines come with side effects, but we only prescribe medicines when we believe the benefits outweigh these side effects. I think there were concerns amongst some patients, obviously, who asked the question.
Yes, because there was a lot of media coverage about it, wasn't there?
I think it was huge, and no doubt it will roll on a little longer, and there will be times when the statin story goes away and then it comes back, because these drugs have been around for a very, very long time. Scientific research has shown them to be effective in what they do, and for the vast majority of people, they tolerate them very well. They don't come with side effects. I mean, obviously you're going to get some people with headaches, stomach upsets for a little while once the body gets used to the drugs, but in the long run, what we see is that they have huge benefits.
One of the other issues here is about the BMJ, and it publishes articles in good faith. It's a very professional publication, but that a report that it's now having to question was published and generated so much interest is a bit of egg on the BMJ's face, really.
Well, I think what the BMJ is doing is very responsible, is acknowledging that they've identified where there was a problem. They're looking into it, and let's face it, that's happens in life. We learn from our not necessarily mistakes, but we learn from when these things arise. And I think there might be a little bit of confidence lost in a publication. There might be a little bit of confidence lost in certain medications and certain guidelines. But what I hope is that people will establish a review process that makes sure that these sort of things can't happen in the future, and indeed we're not left in a situation where patients are worried. And that's my major concern as a doctor, is I don't want patients who are on medicines being worried and indeed stopping these medicines when they could be actually giving them benefits.
Dr. Rob Hicks, thank you very much for talking to us. Thank you.